I would like to acknowledge the traditional owners and custodians of the lands on which we meet today and pay my respect to elders past, present and emerging. I would like to extend that acknowledgement and respect to any Aboriginal and Torres Strait Islander people here online with us today. Today's speaker is Dr. Jinling Gong, who joined the Therapeutic Goods Administration in 2020 and is currently the Director of the Devices Application section within the Medical Devices Authorisation branch. The section comprises medical devices assessors responsible for the regulatory and technical assessment of applications of inclusions of medical devices in the Australian Register of Therapeutic Goods. Jingling has prior experience in administering intellectual property rights for medical devices at IP Australia, as well as managing reforms, project delivery at the Australian National University, and she is a special interest of medicine, medical innovation and enabling health outcomes. She holds a Masters of Biomedical Engineering from the University of New South Wales and a PhD in Neuroscience from the Australian National University. Thank you, Jingling. Over to you.
Thank you very much, Rachel, and good afternoon to everyone. And thank you again for joining us today for the second of 3 webinars on the EU MDR transition. So in today's webinar, we will be focusing on manufacturer's evidence and variations to the ARTG. So in today's webinar, I will run through very quickly on the background and context of the EU MDR transition and implications, which was covered in the first webinar yesterday. We will then dive straight into the manufacturer's evidence or conformity assessment certifications, where through examples and case studies, we will explore when a new manufacturer evidence application might be lodged, and also when a manufacturer evidence variation application may be lodged. We'll work through the various change types for device change requests and variation applications, run through some updates that have been made to our application forms. I'll touch on some common issues we are seeing with manufacturer evidence applications and applications to vary ARTG entries, and we'll then move on to our Q&A segment. So in Australia, most medical devices in the ARTG are supported by European certification. And in 2017, a major update to medical device regulations in Europe was introduced. And the new European medical devices regulations replaces the medical device directives and the active implantable medical device directives. This transition ends on the 26th of May 2024, where devices supported by EU MDD certification will need to transition to the new EU MDR certification in order to continue supply. And this has flow-on implications for sponsors of medical device ARTG inclusions in Australia. The regulatory actions that may be required from sponsors is wide-ranging, and today we will be focusing on 2 of them. Updating of manufacturer evidence or conformity assessment documents associated with ARTG entries, and also amendments to ARTG entries, such as changes to intended purpose or functional description. And a suite of guidance material was published on the 1st of December, including guidance that's specific to manufacturer evidence, device change requests, and variations. These guidance material also include a number of example scenarios and FAQs to clarify regulatory obligations, so please do check them out. We have also published an online assessment tool that will assist sponsors in determining what actions they may or may not need to take as a result of transitioning their ARTG entries from the EU MDD to the EU MDR. And this tool will walk you through a series of questions, and depending on your responses, you will be guided on the most appropriate action to take and the forms to use. And the table on the right outlines the regulatory actions that may be required under the Australian Medical Device Framework. So if a new MDR certification has been issued, you can update your manufacturer evidence on file to the MDR certificate by submitting an ME variation application. And alternatively, if you need to retain the old manufacturer evidence on file, as it might be linked to other entries, you can submit a new ME application. And when that is accepted, you then submit a DCR to link your entry to the new ME. And if the transition has resulted in changes to intended purpose, GMDN code and term, manufacturer details such as name and address, or the need to link the new EU MDR certificate to an existing ARTG inclusion, then sponsors can update their ARTG entry by submitting a device change request application. And for Class 3 and AIMD devices, if the transition has resulted in changes to the total number of devices, variant list, your UPI or functional description, then sponsors can update their ARTG entries by submitting variation applications. And just before we move into some examples and case studies, I'd like to emphasize the definition of a kind of medical device under our framework. So under Section 41BE of the Therapeutic Goods Act, a medical device is taken to be of the same kind as another medical device if they all have the same sponsor, manufacturer, GMDN code, and classification. And additionally, for Class 3 medical devices, Regulation 1.6 prescribes that they are required to have the same unique product identifier, the UPI. And now we'll move into our very first example, where the sponsor is seeking to update all their ARTG entries that is associated with an MDD certificate to the new MDR certificate. So on the left, we have an MDD certificate that is associated with one ARTG entry. And over to our right, we have one MDD certificate that's associated with 3 ARTG entries. So in both situations, the ARTG entries are to be supported by the new EU MDR certificate. So therefore, in this scenario, the sponsor can simply submit an ME variation application to update their ME on file to the new MDR certificate. And in this second example, the sponsor has 3 ARTG entries that are associated with one MDD certificate, but they are only seeking to update a subset of them to be associated with the new MDR certificate. So therefore, in this scenario, the sponsor will need to retain their old MDD certification on file as it is still linked to ARTG entries 1 and 2, and will need to submit a new manufacturer evidence application for their MDR certificate. And when that is accepted, the sponsor would then need to submit a device change request to link their ARTG entry 3 to the new ME identifier associated with the new MDR certificate. So the pathway for this scenario would be a new ME application and then a device change request to delink and relink your ME identifier. Moving on now to the third example, we have a sponsor who is seeking to update their manufacturer name due to a rebranding. So the legal manufacturer in this case remains the same and the QMS remains the same. And if that is the case, the sponsor can update manufacturer details by submitting an ME variation application. You would then need to submit a DCR application to update your manufacturer details on your ARTG certificate. If the legal manufacturer has changed, for example, as a result of an acquisition, then a new application for inclusion will be required as the kind of device has changed. Here we have example 4, where the sponsor is seeking to change their name or address. And in this scenario, they will need to complete a notification change of sponsor name form and email that to ebis@health.gov.au. So please note that changes to sponsor details cannot be done using a manufacturer evidence variation form or a device change request form. Moving on now to example 5, should sponsors be wishing to update the GMDN code or the intended purpose in their ARTG entry, they can submit a device change request application. It's important to note that when a device is included in the ARTG, the GMDN code at the point of inclusion is considered to be valid for the life cycle of the device, even if the code has been updated or has been made obsolete. However, if the sponsor wishes to update the code during the life cycle of the device, the proposed code must not change the kind of device. If it does, then a new application for inclusion will be required. And here we have example 6, which relates to changes that are specific to Class 3 devices. So for sponsors that are seeking to change the functional description, for instance, amending the MRI suitability details, they can submit a variation application. And the supporting evidence we will need to see will include evidence of product assessment, the clinical evaluation report, which is specific to the change in MR conditional capabilities, the patient implant information card and patient implant card and patient information leaflet, instructions for use, and the device label. And for sponsors seeking to update the total number of devices or variants, they can submit a variation application. And again, supporting evidence we would need to see includes the design examination certificate or equivalent, the DOC, and the product catalog. And lastly, for sponsors seeking to update the UPI for their device, they can submit a variation application, and supporting evidence would include design examination certificate or equivalent, DOC, instructions for use, as well as the justification for the change. And now we'll move into some case studies of the common scenarios that we are seeing come through. So here we have Orange, who is a sponsor supplying hip implants under the EU MDD certification. And Peach is the manufacturer of the hip implants and is currently undergoing a rebranding to consolidate their portfolios. And as Peach is transitioning to EU MDR certification, they would like to transition to a new trading name called Pink. And the change of manufacturer from Peach to Pink is a name change only. So the legal entity remains the same with no change to the quality management system or the corporate structure. So in this case, Orange can submit a manufacturer evidence variation application to update their manufacturer details from Peach to Pink, and then lodge a device change request application to update the manufacturer details on their ARTG entry. And in case study B, we have Blue, who is a sponsor supplying thermometers under EU MDD certification. So Code is the thermometer manufacturer and is being acquired by a global conglomerate called HOT, alongside many other medical device manufacturers. So HOT has an established quality management system, which will be applied to the production of Code's thermometers. So if Blue would like to supply thermometers that are now manufactured by HOT, they will need to submit a new application of inclusion for their thermometers as it is now considered a different kind of device due to the change of legal manufacturers. And in case study C, we have Red, who is the sponsor of a patient monitor intended to be used for monitoring physiological parameters in adult patients. So as part of the EU MDR certification, the target patient group was expanded to include pediatric and neonatal patients. So in this case, Red will need to submit a device change request application to update their intended purpose in their ARTG entry. And moving on now to our final case study, we have Tobias, who is the sponsor of a vascular guide wire, which was intended to be used in the central circulatory system under MDD certification. And as part of the EU MDR certification, the scope of the certification was reduced and the intended purpose was revised to exclude the CCS. So in this case, Tobias will need to submit a new application for inclusion as the guide wire is now a new kind of device with a different risk classification. Now I would like to run through some of the changes that we have introduced to the device change request form. So we have introduced a number of new questions as well as data fields, which will better enable us to triage incoming applications and streamline the processing of change requests for sponsors. So on this screen, you will see all the new questions that we have introduced to the DCR application form. These are compulsory questions where the sponsor has to indicate if they are seeking to make the same changes across multiple ARTG entries, and also if they are changing to an EU MDR certification. If their manufacturer details are changing, and if so, is that the name, address, or both? And if they are seeking to update their ARTG entry to a new manufacturer, if they are seeking to update their ARTG entry to a new manufacturer evidence identifier. And also if they are varying their intended purpose, and also lastly, if they're changing their GMDN code. And if the sponsor has selected yes to making the same change to multiple ARTG entries, there is then the option to select up to 9 additional ARTG entries. And also if the sponsor has selected yes to changing to an EU MDR certification, they will be required to input the date of effect of the EU MDR changes. And this is the start date of your EU MDR certificate. And if the sponsor has answered yes to changing manufacturer details, they will be asked to confirm where the supporting evidence is. So select in approved manufacturer evidence if the new manufacturer evidence has already been submitted and accepted by the TGA, and if not, select in supporting evidence to be supplied later, where there will be an opportunity to upload the certificate with the application. And if the sponsor has selected yes to updating their manufacturer evidence identifier, they will need to select the relevant manufacturer evidence that the ARTG is to be linked to from their previously submitted and approved manufacturer evidence. And if the sponsor is varying the intended purpose, the existing intended purpose will appear as uneditable text, followed by a free text box, which has been pre-populated with your existing intended purpose for edits to be made as appropriate. A question on whether there is a reduction, expansion, or a change in scope or no change in scope is then asked. And if the sponsor is seeking to vary the GMDN code, the option to search the TGA GMDN code table would then appear, alongside a question to confirm if the new code will change the kind of device. And on the last page, there is the option for sponsors to provide details of any other changes, and also the option to include the details of any other related DCR or variation applications. So this will allow the assessor to group the applications together for a streamlined review. And another new functionality we have introduced is the ability to upload supporting documentation to the application. The sponsor then has to complete the declaration prior to submitting their DCR application. And the variation form has also been updated with similar changes with the introduction of additional questions and data fields. I'll move on now to highlight some of the common issues that our assessors have identified with manufacturer evidence applications and also DCR or variation applications. So for manufacturer detail changes, it is really important that supporting evidence is provided to confirm that the legal manufacturer has not changed and that the QMS remains the same. So the documentation supplied has to clearly indicate this. So if the legal entity and quality management system has changed due to an acquisition, the new applications for inclusion will be required as it's considered a different kind of device. We've also had instances where sponsors indicates that the scope of the certificate has not changed, but upon inspection, the scope has changed. So just some things to take note of when preparing your applications. I'll move on now to touch on fees and charges. So for new manufacturer evidence applications or variations to existing manufacturer evidence on file, there is no charge associated with these applications. And for device change request applications, a reduced fee of $190 per application is being considered by the government. And if approved, it will allow the update of up to 10 ARTG entries to the same manufacturer evidence identifier under the one single reduced fee. And again, if approved, the fee reduction measure will apply retrospectively to sponsors who have already made the application from the 1st of January 2022. And for any other changes, the full fee of $482 will be charged. And just a reminder that we have a final webinar happening next week on the 13th of December, and that covers consent to supply, lapses in conformity assessment, and also market notifications. And lastly, here are some very useful links and resources that you can look to for the information. And this is our contact, so you could email us at eumdrtransition@health.gov.au should you have any inquiries.
So I'll leave it over to you now. Thanks, Yingling.
Thank you very much, Rachel. We will try and answer as many as we can. And for those that we can't, if you have identified yourself in your question, we will endeavor to get back to you. If not, you're welcome to email us at eumdrtransition@health.gov.au. And depending on the frequency of the questions, we will consider including them in future editions of the example scenarios and FAQs as well. So we'll now move into our Q&A segment, and I'd like to introduce two team members. We have Narelle and Ben with us. Narelle will be assisting us by asking the questions, and Ben, who is our resident expert on manufacturer evidence applications, will be assisting with the responses, and myself as well. So over to you, Narelle, for kicking us off with the questions.
Thank you, Sinlin. So the first question is from an anonymous person. What is the current waiting period for a DCR application? How long does it take for a DCR variation application to be approved?
Sure, thank you, Narelle. So we are currently experiencing an influx of applications, and at present, the waiting period is approximately 2 months. We are, however, trying to streamline the assessment process, and with the new triaging process that we're putting in place, we are hoping to improve this time frame. There is no legislative timeframe as such when it comes to the assessment of a DCR variation application. We do, however, understand the criticality of sponsors getting the changes updated, so we're very mindful of that. It's quite difficult for us to provide an estimate of the actual assessment time period, as that really depends on a number of factors, really depending on the complexity of the issues identified and the volume and the quality of the data that has been supplied to us. So we do appreciate your patience and understanding with this.
Thank you. We now have a question from Gary Burgess. When there are no changes required to ARTG details and it is a simple change from MDD to MDR CE certification, is there a legislative requirement for the sponsor to submit an ME variation or a DCR application to relink the ME identifier of an ARTG entry? If so, what is the clause?
Thank you, Gary, for your question. So there is no legislative requirement as such that the ME must be up to date. It is something that we encourage all sponsors to do to keep your entry complete and correct and up to date as much as possible. So we strongly encourage sponsors to update their manufacturer evidence on file.
Okay, our next question is, what type of evidence will TGA require to demonstrate that the QMS hasn't changed when the legal manufacturer name changes?
Thanks, Narelle. I'll take this one. So the two forms of evidence that we most commonly accept is a letter from the notified body or a letter from the manufacturer. Both of these will need to state the reason for the name change or address change. We'll need to state that the QMS and the legal entity has also not changed. As of 2021, the MDD certificates are not allowed to be reissued regardless of whether there's a change of manufacturer. The notified bodies are getting around this by issuing the certificates under Article 120, subsection 3 of the European Medical Device Regulations. So if the certificate has something which indicates that the change has been assessed under this article, we will also accept this.
Thank you, Ben. Our next question is, you mentioned most products registered on the ARTG are supported by EU certification. Are there any direct entry options for inclusion on the ARTG for manufacturers not seeking EU MDR certification?
So under our framework, we do accept evidence from a range of regulators. So we have the comparable overseas regulated scheme where we do accept evidence from, for instance, the US FDA. We also are part of the MDCEPT consortium, and we do accept MDCEPT certifications as well. Australia is an auditing organization with the MDCEPT. We also accept, obviously, TGA conformity assessment certificates should sponsors choose to come to the TGA to seek a conformity assessment.
Thank you. Our next question is, what is the difference between applying for a new ATRG under the MDR certificate, then terminate the old ARTG and bearing entries in the existing ARTG?
Thanks, Narelle. Sorry, so they are both valid actions, although depending on the classification and the risk profile, the new application for inclusion may be subjected to a non-mandatory audit. If the MDR certification does not change the kind of device, then a more straightforward pathway is really for the sponsor to update the existing ARTG entry, and that is what we encourage.
Thank you. Our next question is, 2B and lower class devices, why is a variation needed? Why not create a new ARTG inclusion with updated GMDN, intended purposes, etc.?
2B and lower classification devices, that variation applications wouldn't apply. So a variation application is only for class 3 and AIMD devices. If seeking to amend the GMDN code or intended purpose, that would be a device change request application.
Thank you. Our next question is, what should a sponsor do if one ARTG is now supported by 2 or more conformity assessment certificates rather than one conformity assessment certificate previously? More than one ME cannot currently link to the same ARTG.
Sure. So if that is the case, the sponsor should associate their ARTG entry with the most relevant manufacturer evidence document. So whichever certification is the most relevant should be associated with that ARTG entry, and they should hold evidence of the other relevant conformity assessment certifications and be able to produce that if requested by the TGA.
Thank you. Our next question is, if the CE mark is revoked from an Australian manufacturer, can the device continue to be supplied in Australia under the TGA?
So the CE marking is something that is of relevance in Europe, but within Australia, it will be whatever is relevant within the Australian medical device framework. So if they do hold a relevant certification, conformity assessment certification that is being recognized and is still valid under our framework, then there's no problems in supplying those devices.
Great. Our next question is, should we submit DCR for reducing indication, for example, vascular plus iliac indication for vascular only?
Yes, if that is a change to the intended purpose, then a device change request application can be launched to amend that.
Thank you. Next question is, when will the reduced fee be confirmed and implemented? What sort of records will be required to claim if the higher amount has been paid?
It's currently heading to the is waiting for a government consideration, and the earliest that could happen would be towards the end of this month. So it really just depends on the time frames. But as I said, it will be applied retrospectively to all applications that were submitted from the 1st of January 2022. So the team will be undertaking a once-off exercise once we have the regulatory change in place. We will do a once-off exercise to work out which were the affected sponsors that should be receiving a refund of the fee difference. And we will be proactively doing the fee refunds.
Thank you. Our next question is, if our ARTG was registered very long time ago, how can we know the identifiers registered in this ARTG?
So the manufacturer evidence identifier, I believe it's an alphanumeric string, or might just be a numeric string that is listed on your ARTG certificate, and that is your manufacturer evidence identifier.
Thank you. Our next question is, what are the requirements for non-Australian manufacturer to supply medical device to Australia?
Okay, so unless exempt or excluded, all medical devices must be included in the ARTG before they can be supplied. And the application to include the device in the ARTG must be made to the TGA by an Australian-based entity known as the sponsor. So sponsors are legally responsible for the supply and sale of the medical device in Australia, including, they also have a range of obligations, including ensuring that the device meets all regulatory requirements, meets all post-market obligations, including adverse event reporting, and also ensuring that advertising is compliant with the Therapeutic Goods Advertising Code. So I guess in short, in order to supply, device must be on the ARTG and it's the responsibility of an Australian-based entity known as a sponsor in Australia.
Thank you. Our next question is, can the DCR application be utilised to transition the currently included ARTGs for the same kind of devices, linked with MDD CE as manufacturer evidence, to relink with MDSAP as ME? If so, what information is required to be submitted with the DCR?
Okay, I think this question is asking if we could, if the manufacturer evidence can be updated from MDD to MDSAP. The answer is yes, if the MDSAP certification covers the same scope as the devices that are on the ARTG. If that is the case, as outlined in earlier examples, sponsor can apply for a manufacturer evidence variation to update their MDD on file to the MDSAP. Alternatively, if they still require the MDD to be linked or associated with certain ARTG entries, they can launch a new manufacturer evidence application for their MDSAP and then delink and relink the ARTG entry for the MD to be associated with the MDSAP certification.
Thank you. Our next question is, in a situation where an MDD CE certificate expires and there is a gap before they can get the MDR CE, but they have the appropriate COR approval to cover the gap, do we need to relink the ME to the COR ME considering the ARTG will eventually be linked back to the MDR-CE?
That is probably a sponsor decision. As mentioned earlier, ideally we would like ARTG entries to be up to date. So sponsors could either choose to update and do an ME variation and update that certification on file to the interim certification, and then do another update when they do get their MDR certification. Or alternatively, they can simply hold on to the interim evidence, interim conformity certification evidence that they have, and then wait for their MDR certification to be issued and then update their ARTG entry to that.
Thank you. Our next question is, why is the TGA asking if we are transitioning to MDR in the application form? Will this help filter MDR submissions, resulting in shorter processing times versus using MDSAP, for example?
Sure, we are asking that for a number of reasons, in part for analytics and reporting purposes, for us to be aware of what our sponsors or manufacturers transitioning to. We may potentially also be utilizing that to streamline application processing. We are aware that there is a delay in the issuance of MDR certifications, and this is causing a bit of anxiety in some sponsors and manufacturers and in the sector in terms of not wanting to affect supply. So one wanted to make sure that there's no supply disruptions. So that could potentially be a factor in the coming months or years when we process our applications.
Thank you. Our next question is, I have multiple devices covered under the same ME, but they will not transit to a new MDR EU certificate all at the same time. Can I wait till all the devices are obtained? I have obtained the MDR certification before updating the ME.
Sure. So this is a common one that we get, and it's also in our FAQ on our guidance, a suite of guidance documents as well. So sponsors have the option to either wait for all their devices to transition and then update their MDR certification, or they could choose to update them individually as and when they are ready. And we will leave it to the sponsors in terms of what their strategy is to do that.
Thank you. All right. Our next question is, why a relinking application needs to be submitted once the new ME is submitted? Is it not obvious that the new ME will need to be linked? Can the ARTG entries be listed at the time of uploading the new ME so that a further relinking application be avoided?
Unfortunately, this is due to limitations in our system. We do have an ME repository, a manufacturer evidence repository that is quite independent and is not associated with ARTG entries. That association only takes place when you, for instance, apply for a new application for inclusion. You would then have the option of selecting from your library of manufacturer evidence, which is the relevant one for you to associate your ARTG entry with. And that is how the entry is being linked to a particular ME. And so therefore, there is a need to delink and relink so that that association is made.
Thank you. Our next question is, does the transition to the MDR affect Class 1 devices?
Not on the surface, because Class 1 devices under our framework, we're relying on a manufacturer's declaration of conformity. So I guess if it is affected, it is on the part of the manufacturer to be certain that they are still compliant, that their devices are still compliant against all essential principles under the Australian regulatory framework. But in terms of certifications, etc., that doesn't really come into play, as it's DOCs for Class 1 devices.
Thank you. Our next question is, manufacturers use GMDN agency to allocate GMDNs to devices. The TGA GMDN search function is not aligned or updated to match the GMDN agency. What happens in the case where a manufacturer updates the GMDN, but the TGA GMDN search function does not have that GMDN, or the GMDN description is different?
This is unfortunately a very long-standing issue. The TGA has had some issues with its code tables, and there has been ongoing work to resolve this. So work has progressed where if there are new GMDN codes in the GMDN, with the GMDN agency, the TGA is currently able to update and include the new GMDN codes that has been introduced. Where the trouble starts is for existing GMDN codes, which might have changed its description and purpose. And for those ones, it is presenting a bit of a problem. So where the code is not aligned, we are working with sponsors on means to resolve that. So as mentioned earlier, at present, our policy is that at the point of inclusion, if a GMDN code is accepted, that code will be valid for the life cycle of the device. And should a sponsor wish to update that code to a more relevant one, making sure that it's still the same kind of device, they can do so. And if they do encounter any issues, to please get in touch with us and we'll work with them on a way forward.
Thank you. Our next question is, how many ARTG entries can I amend in one DCR application?
So in one DCR application, if you are making the same change across multiple ARTG entries, you're allowed up to 10 ARTG entries. So for instance, if you are updating the manufacturer's name and that affects 9 ARTG entries, you can launch one single DCR application and have the same change amended across 9 ARTG entries.
Thank you. Our next question is, with what evidence can a sponsor notify the TGA of manufacturer's change of address when the updated CE certificate is not available due to notified bodies not updating the MDD certificates due to the MDD to MDR transition?
Thanks, Narelle. I'll take this one. I'll give Sinlin a well-deserved break. So for these, obviously, the certificates cannot be reissued after May of last year. So this is where we would only be accepting evidence from the notified body. So the notified body needs to basically prove to us that the change is non-significant. So you'll see that Article 120, subsection 3. And they just need to inform us that the certificate is still valid with the new manufacturer's address. So under that Article 123, the design of the device must stay the same. And then all that information must remain the same as well. So, yeah.
Thank you, Ben. Our next question is, device application section had advised us that we should notify the TGA of expired MDD certificates using the DVS at health.gov.au via email. Please confirm if email and online models are accepted, as we have been notifying via email.
Thanks, Narelle. So a brand new form has been made available, I believe, last month. So it is the Lapses in Conformity Assessment Notification Form. It is a citizens-based form that sits on Consultation Hub. We can probably try and get the link up. If not, it is in the Rachel is on the it's on the resources page. I think you should be able to find that link there. So sponsors should advise us of any expiring certifications within 60 days, as Amanda had mentioned in the webinar yesterday, and they can do that by submitting that online form. And when they receive their new MDR certification, they can then notify the post-market area using that particular email, dvs@health.gov.au.
Thank you. Our next question is, if the change is only MDD certificate to MDR certificate, does a device associated with the certificate need to go through the device change process?
I'm not quite sure what this question is asking. So if you are changing from MDD to MDR and there's no other changes, so the scope remains the same, for instance, then sponsors are encouraged to update their certificate on file. And apart from that, there's no other changes really. It's just, if possible, keep your ARTG up to date by updating your manufacturer evidence.
Thank you. Our next question is, if a sponsor wants to change the supporting manufacturer's evidence from a TGA conformity assessment certificate to an MDD or MDR certificate and also submit product changes, that would be considered a substantial change under the TGA CA. Can this be done as one DCR?
Oh, this is a good one. I'll probably need to confer with colleagues in the conformity assessment section on this one. I think it will depend on whether the substantial change is incorporated in the MDD or MDR certification. So yeah, I think this is probably best taken offline, and we will consider this one and update our guidance once we arrive at a consensus. Thank you.
Thank you. Our next question is, can an ARTG for the same kind of device be linked with more than one ME?
No, so each ARTG entry can only be linked to a single manufacturer evidence. So as mentioned earlier, we encourage all sponsors to associate the ARTG entry with the most relevant ME and to hold evidence of all other ME that's required for the ARTG.
Thank you. Our next question is, does the TGA recognise the terms made available on market put into service stated from the MDR to extend to Australia under Article 120, Part 4, such that devices are able to be supplied in Australia until 27th of May 2025, where there is valid MDD certificate until 27th of May 2024?
So as Amanda outlined in yesterday's webinar, there is this clause in the in Europe, and we've adopted a somewhat similar position in that if your MDD certification is expiring and you have no valid certification thereafter, we expect sponsors to be ceasing supply at the 12-month mark or within 12 months of your MDD certification expiring. So that is a very similar policy that we have to what's happening in Europe.
Thank you. Okay, our next question is, the end date of the market notification system is May 2024. How some products won't get MDR approval until after?
So once again, the end date of the MDD certification is May 2024, and there may be devices who receive MDR certification after this this date. And so depending on whether there is a gap in certification or whether the manufacturer does not intend to seek certification thereafter. So in the first situation, sorry, in the second situation where the manufacturer does not intend to seek certification thereafter, they have 12 months to exhaust the MDD stock. And in the event that they do have a gap in their certification, they will need to notify in both cases, they will need to notify the TGA within 60 days of the MDD certification expiring. And if they do get their MDR certification, they will need to notify us that they have received it. And in the event that they are aware that their devices are no longer compliant with essential principles, for instance, due to labeling changes or due to the lack of clinical evidence, then they will need consent to supply.
Great, thank you. Our next question is, are products registered on the ARTG using other kinds of conformity assessment, for example, MD-SAP, out of scope of the EU MDR transition requirements?
If products are supported by MD-SAP or other non-European certification, they aren't affected by the EU MDR transition as such. Having said that, very similar rules will apply. So if their MD-SAP certification expires, for instance, it's legislated that they will have to notify us within 60 days. So those same rules will apply.
Thank you. Our next question is, can we apply for IP and ME change in one DCR?
Yes, so you can apply for changes to intended purpose and manufacturer evidence within the same DCR. So for instance, you might be updating your intended purpose and also seeking to delink and relink your manufacturer evidence identifier.
Thank you. Our next question is, what happens if the legal manufacturer changes, but the actual manufacturing facility is the same? Is this considered a variation application or a new application?
I can take this one. So if the legal manufacturer changes, that would be a change under 41BE of the Therapeutic Goods Act. So you will require a new application in that case.
Thank you, Dan. Our next question is, what happens if the manufacturer will have MD, SAP and MDR?
The more the merrier. We don't have a problem if manufacturers have more than one certification type, as long as they have certification with appropriate scope and is accepted under our 2018 determination.
Thank you, Sinlin. Our next question is, we're interested in the ME for Class 3 medical devices containing microbial origin during EU MDR transition.
So with the repeal of Regulation 4.1 and amendments to Regulation 5.3, manufacturers of Class 3 medical devices containing substances of microbial origin, they are no longer subjected to requiring TGA conformity assessment certification. So if the application is supported by an MDD certification, it will be subjected to a mandatory audit. And if this application is supported by MDR certification, it may be subjected to non-mandatory audit at the discretion of the delegate. And if this device is already on the register and there is a gap between the existing certification and the upcoming MDR certification, then once again, sponsors must notify the TGA within 60 days of becoming aware of the certificate expiring.
Thank you. Our next question is, will the DCR forms and variation forms, etc., be able to be located from the business portal?
Yes, so they are currently on the eBIS portal. There's a DCR form and also a Class 3/AIMD variation.
Okay, our next question is, if the overseas manufacturer reclassified their product due to the update of the safety, would this mean automatically reclassification under TGA?
No, so the classification of a product, it would be based on classification rules within our medical device regulatory framework. So having said that, we are largely aligned with Europe. So it really depends on what the change is, and I think the sponsor will need to refer to our classification rules and make a determination if that classification has changed.
Thank you, Sinlin. Last question. If the intended purpose is changed along with the classification of the device, what application will I need to submit?
It will require a new application for inclusion because the classification of the device has changed. So that change will render it a new kind of device. So it will be a new application for inclusion.
Okay, thank you very much, Xin-Ling and Ben. Sorry, what were you, Rob? Sorry about that. And Narelle. We have received many of questions and we are going to have to take them offline now. The team will review all the questions and I believe that you're going to be referring them to the existing frequent questions and maybe review some of that page that you have already on the website based on all these questions. So thank you very much and we look forward to seeing you next week for our final webinar number 3. Thank you very much, everyone.